Ah, allergens in cosmetics. Allergic reactions to personal care products like soaps, lotions, face and eye makeup, and fragrances are relatively common in the United States. Studies indicate that approximately 1 to 5% of the population is sensitized to cosmetics or cosmetic ingredients, with reactions more prevalent among women aged 20 to 60 years. In patch testing studies, about 10% of individuals exhibit allergic responses to cosmetic products. Fragrance ingredients are among the most common allergens, affecting 1 to 3% of the general population, and are responsible for 16% of allergic contact dermatitis cases. Additionally, a significant portion of the population reports irritation from fragrance products, with 31% finding scented products on others irritating. These statistics highlight the importance of awareness and caution when using personal care products. Allergic reactions are the immune system's overreaction to substances that may otherwise be harmless. Things that cause allergic reactions are called allergens. An allergen can trigger the immune system to release chemical substances such as antibodies that result in allergy symptoms. The underlying mechanism involves immunoglobulin E antibodies, or IgE, part of the body's immune system, binding to an allergen and then to a receptor on mast cells or basophils, where it triggers the release of inflammatory chemicals such as histamine. Cosmetics allergens fall into the following 5 classes. Natural rubber, fragrances, preservatives, dyes. Metals. Natural rubber is also listed on labels as latex. Fragrances may be composed of these ingredients: amyl-cinnamyl, amyl-cinnamyl alcohol, anisyl alcohol, benzyl alcohol, benzyl benzoate, benzyl cinnamate, benzyl salicylate, cinnamyl alcohol, cinnamaldehyde, citral, citronellol, coumarin, eugenol, phonosol, geraniol, hexyl cinnamaldehyde, hydroxycitronellol, hydroxyisohexyl 3-cyclohexene carboxaldehyde, (CCC), also known as Lyrol, isoeugenol, Lilol, D-limonene, linalool, methyl 2-octanoate, G-methylionone, oak moss extract, tree moss extract. Preservatives may be listed as methylisothiazolinone, or MIT, and methylchloroisothiazolinone, also known as CMIT. Formaldehyde and formaldehyde-releasing ingredients include bronopol, which is 2-bromo, 2-nitropropane-1, 3-diol, and 5-bromo-5-nitro-1, 3-dioxine. Other common preservatives are diazolidinyl urea, DMDM-hydantoin, which is 1,3-dimethylol-5, 5-dimethylhydantoin, and imidazolidinyl urea. You might also see sodium hydroxymethylglycinate and quaternium-15, also known as Dawacil 200 or N,3-chloroallyl hexaminium chloride. So, dyes or chemicals in dyes and color additives, such as those used in hair dyes and black henna tattoos, may include p-phenylenediamine or PPD and coal tar. Metals might be listed as nickel or gold. Hypoallergenic cosmetics are products that manufacturers claim produce fewer allergic reactions than other cosmetic products. Consumers with hypersensitive skin, and even those with normal skin, may be led to believe that these products will be gentler to their skin than non-hypoallergenic cosmetics. The term hypoallergenic means whatever a particular company wants it to mean. Manufacturers of cosmetics labeled as hypoallergenic are not required to submit substantiation of their hypoallergenicity claims to FDA. That's right, there are no accepted tests, guidelines, restrictions, or rules of any kind for determining if a skin or hair care product qualifies as hypoallergenic. Clause: checking labels for hypoallergenic, fragrance-free, or for sensitive skin isn't enough because certain ingredients may be listed as fragrance or perfume without identifying these specific ingredients. It's essential to remember that hypoallergenic does not mean allergen-free. A crucial key when shopping for hypoallergenic skincare is to prioritize ingredients more than the label itself. Repeated exposure to allergens can increase sensitivities over time, making hypoallergenic products a good preventative choice for everyone. Patch testing is used by dermatologists to determine whether your skin condition is caused by an allergy to substances in direct contact with your skin, also known as contact dermatitis. This test, however, is not useful in investigating irritant dermatitis. During the test, you will be exposed to around 40 standard substances that commonly come into contact with the skin, such as rubber, chemicals, metals, perfumes, and plants, along with any additional relevant substances. Each substance to be tested will be applied to your back in special small disc containers, held in place by hypoallergenic tape. Occasionally, the arms or the thighs are also used for patch testing. Itching of the test areas is normal, but you are advised not to scratch. It may be necessary to expose part of your arm or back to ultraviolet light if a reaction to sunlight is suspected. This is called photopatch testing. Your doctor may decide not to patch test if you are pregnant, breastfeeding, have extensive eczema on your back or other skin disease, have used a sunbed or been sunbathing in the previous 6 weeks, are taking a moderate or high dose of prescribed steroid tablets, have applied steroid ointments or creams to the back within 72 hours, or are taking other drugs which suppress the immune system. Other less frequently used tests include prick test, intradermal test, and allergy blood test. Allergic reactions can range in severity, but may include hives, itchy skin, a rash, flaking or peeling skin, facial swelling, irritation of the eyes, nose, and mouth, as well as wheezing and anaphylaxis. Most recent data suggests that people in the US have a 0.05% and 2% lifetime chance of experiencing anaphylaxis. If you have an allergic reaction to personal care products like soaps, lotions, makeup, or fragrances, follow these steps. Stop using the product immediately. Discontinue all suspected items to prevent worsening symptoms. Rinse the affected area. Gently wash your skin with lukewarm water and a mild, fragrance-free cleanser to remove any remaining product. Apply soothing treatments. Use over-the-counter hydrocortisone cream or a cold compress to reduce inflammation and itching. Avoid scratching. Scratching can break the skin and lead to infections. Take antihistamines. Oral antihistamines like diphenhydramine, Benadryl, can help reduce itching and swelling. See a dermatologist. A specialist can perform patch testing to identify specific allergens and suggest suitable alternative products. Read labels carefully. Once the allergen is identified, avoid products containing that ingredient in the future. Anaphylaxis is a severe allergic reaction that can be life-threatening. Symptoms of anaphylaxis are lack of consciousness, shortness of breath, trouble swallowing, lightheadedness, chest pain, a rapid, weak pulse, nausea, and vomiting. What is anaphylactic shock? A person who has an anaphylactic reaction can go into anaphylactic shock when their blood pressure drops dangerously low. Bronchial tissues, which help carry air, may begin to swell and cause wheezing, shortness of breath, and even loss of consciousness. Anaphylactic shock requires immediate treatment to save the person's life. What to do? Use epinephrine. EpiPen. If you have an epinephrine auto-injector, use it immediately. The only treatment for anaphylaxis is epinephrine, which comes as a shot you inject into your thigh. Epinephrine works quickly to reverse symptoms. Even with treatment, a person experiencing anaphylaxis needs to go to the nearest emergency room. With prompt treatment, most people make a full recovery. Call 911 or local emergency number even if you've already administered epinephrine. Follow up with your doctor. After an anaphylactic reaction, it's important to see your doctor to discuss allergy management and prevention. If you're nearby when someone is having an anaphylactic reaction, the person may need CPR as well. Ways to help. Lay the person flat unless they're having trouble breathing. In that case, help them sit up to make it easier to breathe. If the person's unconscious, put them on their side. Open up their airway by lifting their chin. In addition to allergic contact dermatitis, fragrance ingredients may also affect the respiratory system because they can be inhaled, resulting in shortness of breath, the sensation of being suffocated, coughing, phlegm, a runny or stuffy nose, headache, chest tightness, and wheezing. However, you don't have to wait until you have an allergic reaction to try and figure out what you're allergic to. Your healthcare provider may recommend you undergo patch testing or some other less frequently used tests. The Modernization of Cosmetics Regulation Act, MOCRA, of 2022, significantly expands FDA's rulemaking and enforcement authority over cosmetics, and creates substantial new compliance obligations for manufacturers, packers, and distributors of cosmetics intended for sale in the United States. Contact ITB Holdings LLC at www.itbholdingsllc.com. You may want to use the free live support chat available 24/7, including in foreign languages for your convenience. If you found this video helpful, be sure to like, share, and subscribe to our channel for more valuable insights, tutorials, and industry updates. Hit the bell icon to receive notifications whenever we release new content. Until next time, stay safe, stay compliant, and stay tuned. See you next week.